Hi, my name is Julie Gardner, MD, in DeWitt and Stuttgart Medical Clinic. I did my undergraduate training at the University of Arkansas in Fayetteville. I worked for a year as an EMT after that before applying to medical school at UAMS in Little Rock. After my medical school training, I did my residency training at UAMS as well as Arkansas Children's Hospital in internal medicine and pediatrics. I was working with my primary care doctor where I grew up in Dumas, Arkansas, and I was asking him about why he was doing what he was doing and how he was able to see so many patients a day. And he told me the reason he does it is because there aren't enough doctors there to help take care of all the patients who need help. So it just felt like a calling to me, a place that I could step in and use my skills and training to help those in my community. I grew up in Dumas, Arkansas, and I loved growing up in a small town, and I experienced firsthand the medical disparities that happen down in Southeast Arkansas and in rural areas. And so I knew from the beginning when I started medical school that that's what I wanted to do. I wanted to go back into a rural community and use my medical training to help serve the community that I grew up in. My training is in both internal medicine and pediatrics, so I'm dual certified in those fields. So I'll be doing primary care in the clinic. I'm able to do annual physicals. I'm able to do well child checkups. I'm able to do women's health as well. I can manage chronic medical conditions as well as acute sick visits. So really a broad spectrum, and that's why I chose internal medicine and pediatrics, because I really love everything about medicine and wanted to know some about everything. I am excited to get to do primary care in a rural community, but one of the hardships is that we don't have the backup of a large trauma center of the specialists, but fortunately we are close to Little Rock, and so we're able to help transfer those patients who need the higher level of care quickly and efficiently. One of the best parts about my job is my patient interaction. Getting to form that relationship with patients, getting to care from them from when they're an infant all the way up into their adulthood, and taking care of them as elderly as well. So I really kind of view medicine as a team sport, and so I'm really ready to come alongside my patients and to work with them to help them live the best quality of life possible. I really love pediatrics. I love getting to care for children. It's one of the best parts of my jobs. I'm really interested in preventative health care, and so I would love to take care of children from the time they're born as they grow up into adulthood, making sure that we catch things early and intervene early, work on development, to just give them the best quality of life as they go forward and get ready for school and open up opportunities for them. When I'm not working, I'm married, so I enjoy spending time with my husband. We have a black lab boomer, so really enjoy spending time with them. Have a big, loud, loving family, and so I try to visit them as much as possible. Enjoy running, indoor cycling, cooking, and reading. Those kind of things you'll find me doing when I'm not at work. Faith is a huge part of my life, and it's a huge part of why I am in the role that I'm in. I really want to come alongside of patients during their hardest times, and I want to help them through these times using faith, using that hope that Jesus gives us. And I would love to be able to pray with patients and to try to provide them with that hope and love that Christ shows to us. I'd love to be able to show it to other people.